So if you consider this neurological conditions, which can also manifest like psychiatric conditions,
Sir, you are not audible now. stay. Hello, hello.
सर
कौन बोलिए सर की?
सर ଭଏସ୍ ତ ସାର୍ଙ୍କର ଆସିଲାନି ବୋଧହୁଏ ସାର୍ ବ୍ୟାକ୍ ହେଇଗଲେ କି କ'ଣ କି ମୁଁ ଭାବିଲି ନେଟୱାର୍କ
ସାର୍ କଣ କହିଲେ କି ଗଲା ପୂର୍ବରୁ?
ସାର୍ କିଛି କହିଲେନି ସାର୍ କହିଲେ ସରି ମୁଁ ଟିକେ କ'ଣ ଥିଲି ବ୍ୟସ୍ତ ଥିଲି ତାପରେ ଭଏସ୍ଟା ବି ଟିକେ କ୍ଲିଅର ନଥିଲା ସାର୍ଙ୍କର ତାପରେ ସାର୍ ବ୍ୟାକ୍ ହେଇଗଲେ କି ନେଟୱାର୍କ ଇସ୍ୟୁ ଥିବ କି କ'ଣ ପେସେଣ୍ଟ ଆସିଥିବ କ'ଣ ହେଇଥିବ ମେ ବି
ଠିକ ଅଛି ଜଏନ୍
ସାର୍
କରିବେ ତେଣୁ
ଆମେ ସାର୍ ଲାଇନ୍ରେ ଅଛୁ ଆଉ
ଠିକ ଅଛି
ସାର୍
ସାର୍ଙ୍କର ନେଟୱାର୍କ ଇସ୍ୟୁ ହଉଛି ତେଣୁ ଟିକେ ୱେଟ୍ କର ସାର୍ ଜଏନ୍ କରିବେ
ଆଜ୍ଞା ଆଜ୍ଞା ସାର୍
Hello, am I audible?
Yes, sir.
Okay, sorry, there are a lot of technical problem, but however, we can restart the class. Have you heard that organic brain syndrome? The medical condition which can manifest like
Sir,
psychological
please,
symptoms.
sir, please, beginning from the start, please.
Okay, okay. So the today we'll study one module which is mostly about the medical conditions which manifest or which when they are patient suffers from those medical conditions, then they develop some psychological symptoms. Clear? So for
Yes, sir.
example, suppose somebody has a thyroid problem, hypothyroidism. So patient might have lethargy, dysphoria, depressed mood, memory problem, and feels very restless, crying spells. So, but if you treat for depression, then things will not be clear or things will not improve. When you treat for thyroid problem, then patient will become better. So this is a clear example or a very common example of patient having medical conditions which manifest as psychiatric symptoms. And those, if you are not very keen or if you don't have the knowledge, then we will miss hypothyroidism or other medical conditions and finally land up in problem. So like that, when you classify medical conditions leading to psychological symptoms in the classification, first is neurological problem. Neurological problem. So in the neurological problem, under that heading or subheading, you can write brain tumor, epilepsy, Parkinson disorder, Parkinsonism, epilepsy, brain tumor, multiple sclerosis, and stroke. So these are very common conditions where patient will develop psychiatric symptoms. So let's start with the brain tumor. Brain tumor is a condition otherwise known as a tumor which is developed in the inside the brain box or it is inside the cranium, cranium, cranium. So inside the brain parenchyma, patient might develop a growth which is otherwise known as space occupying lesion, SOL, space occupying lesion. Depending on the site of the brain tumor, which part of the brain it is originating from, which part of the brain it is pressing to, patient will have symptoms accordingly. Suppose a brain tumor is in the frontal lobe, so you can write when the brain tumor is in the frontal lobe, patient will develop personality change. Brain tumor is in the temporal lobe, patient will have memory deficit. If person develops brain tumor in the occipital lobe, then patient will have visual problem. If the patient develops brain tumor in the parietal lobe, patient will have problem in the emotion and certain motor behavior, sensory motor behavior. Okay. So depending on the site, size and the stage of the brain tumor, patient will have psychological or neurocognitive symptoms. So by seeing the neurocognitive symptoms, we should not treat, rather we should do a CT scan or MRI brain to find out the primary cause and location stage of the brain tumor. Understood? Am I clear?
Yes, sir. You're clear, but many
Yes,
things are
sir.
new for us. That's why they are little. Not.
Okay. So when you go and read your text, there's in simple version they are given, but it is the area which guides personality of a person, personality or personality trait, or different individual have different types of personality that might change. Temporal lobe is related to the memory, and if the temporal lobe has a tumor is sitting on the temporal lobe, then person will have visual memory or verbal memory deficits. Will tell something, they might forget, and that will continue, and that will might be the initial symptoms of the brain tumor in the temporal lobe. In the parietal lobe, because that is the sensory endpoint, so different sensation might change. So sensory motor behavioral change if it is in the parietal lobe. And fourth, I talked about occipital lobe. Occipital lobe majorly it has related to the uh, vision. So there might be a visual problem. If the tumor is more towards the cortex, cortex means just below the cranium, then chance of epilepsy is high. So these are the mostly the symptoms we should be. Suppose somebody in an elderly age group person or a middle aged person talks about suddenly having a memory problem or having visual problem or having some motor sensory motor symptoms or personality change, we should always look for a CT scan or MRI to rule out or to clear from our mind that there is no SOL. Okay. Next, I talked about Parkinson. Parkinson disorder patients, 30 to 40% patients will have anxiety symptoms, depressive symptoms along with Parkinson disorder. They will have tremor, hypokinesia, that is bradykinesia, and they have rigidity, that is Parkinson. Have you seen Parkinson patients? Parkinson disorder patients? If you put Parkinson disorder patients gait or symptoms in the YouTube, you can see how the Parkinson patients behave. But they have certain time more of anxiety symptoms, more of depressive symptoms, and while treating with anti-Parkinson medication, patient might develop manic or hypomanic symptoms. So we have to be careful while dealing with Parkinson patients because they can have overlap symptoms. Certain Parkinson disorder patients can also have cognitive deterioration or memory problems. Third, we will talk about epilepsy. Epilepsy is a huge chapter, but for you, it is those who suffer from complex partial epilepsy. Complex partial epilepsy. There are simple partial epilepsy, another condition called complex partial epilepsy. In complex partial epilepsy, patient will have different psychological symptoms as aura. Aura is just before the epilepsy. Aura or intraictal and intraictal stage. Mane before the epilepsy, during the epilepsy, and after the epilepsy, patient might have psychological symptoms. Okay, patient might get pseudo hallucination. Patient might get anxiety, panic-like feeling. Patient guide can be confused. So these are the symptoms most commonly seen in epilepsy. And one more important thing is if patient is having chronic epileptic disorder, they might develop epileptic personality change. Epileptiform, epileptiform personality change. These people who develop personality change because of the chronic epileptic disorder. Fourth, we'll talk about stroke. We know in our family member or our grandparents or any other friends, parents might develop stroke. That is called cerebrovascular accident. CVA, cerebrovascular accident, CVA. Because of the that is otherwise known as scientific this thing is stroke. Because of the stroke, patient develops paralysis or weakness of one side of the body. So because of the stroke, this happens. Okay. So these patients of stroke might develop at times depressive symptoms, anxiety symptoms, even less commonly psychotic symptoms, and other symptoms of violent behavior or aggressive behavior because of the post-stroke scenario. Which part of the brain the stroke is happened or the cerebrovascular accident had happened, accordingly they will have stroke related psychological crisis. So these are the neurological conditions which can manifest like psychiatric symptoms. Next is about vitamin related deficiency. You can write vitamin related deficiency. If the patients have B1 deficiency, thiamine, vitamin deficiency, patient can have wet beriberi or dry beriberi. Because of the thiamine deficiency, patient can develop depressive features, memory problem, lethargic behavior, and these children or adolescents should be given thiamine supplementation. There are a lot of other picture to know how the vitamin B1, B2, B3 get deficient. If in case of niacin deficiency, the patient might develop uh, dermatitis, and patient can develop cognitive problem by memory problem, diarrhea, and other things. So those cognitive problem are not because of memory loss; those are because of the niacin deficiency. Vitamin B12 is a very major neurovitamin, that is methylcobalamin, vitamin B12. Because of the vitamin B12 deficiency, patient will have multiple neuropsychological symptoms. Some patient develops confusion and disorientation. Last time I told you, because of the vitamin B12 deficiency, patient can present with confusion or memory problem. Secondly, because of the vitamin B12 deficiency, patient can develop catatonia. Catatonia is a psychomotor retardation stage where in the catatonic state, patient will be almost like a freeze. They will remain stand still. They become psychomotor retarded, and they will not talk. They will not eat. They will be like a statue. So this condition also can happen with vitamin B12 deficiency. In vitamin B12 deficiency, patient can develop almost like picture like depressive syndrome, and they should not be mistaken as depression, and they should be treated with, you can do blood test, serum vitamin B12 level, and serum vitamin B12 level, if it is less than 250 or 150, then it is severe vitamin B12 deficiency. We have to supplement them with methylcobalamin injections and then tablets, and then the vitamin B12 level will gradually become normal. Once it will become normal, then person will gradually improve from the confusion, memory problem, depressive features, and other problem, so that they become gradually better. So these are mostly the features of vitamin B12 deficiency. So like that, vitamin D3, cholecalciferol. If the vitamin D is less, then patient can have weakness, bone pain, and if it is more severe, patient can have other symptoms of memory deficits and other problem of like depression, and they need to be supplemented with vitamin D as well as calcium, and then gradually patient improves, not by giving psychiatric medications. They should be given vitamin supplementation. We have to find out why the first things are happening and then give the medication accordingly. So these are the conditions where the vitamin is deficient. So initially we discuss about the neurological problem, how they can manifest with psychological symptoms like brain tumor, Parkinson, stroke, multiple sclerosis, and other things. Like that, we can discuss about vitamin B1, vitamin B3, vitamin B12, vitamin D, and other thing like calcium and vitamin D, and how they can have psychological symptoms. In third point, other hormonal disorder. can manifest as psychiatric symptoms. One most important is thyroid. Hypothyroidism, if there is a decreased thyroid hormone formation or if it is increased thyroid hormone formation, patient will have mood symptoms, motor symptoms, memory problem. Patient can be tearful, patient can be lethargic, as I told in the beginning, can have sleep disturbance, can have problem in the appetite, and lot of other problems which can lead to mood disorder, or patient will we will feel that patient is having some other problem, but patient must be suffering from severe thyroid deficiency. Parathyroid hormone deficiency. Parathyroid hormone deficiency, patient can have psychotic symptoms. These are the conditions where the calcium metabolism get affected and the cell homeostasis get disturbed, and the patients can have cognitive problem. Patient can develop psychotic problem. Then other hormonal problem is uh, adrenal deficiency. Adrenal hormone or cortisol hormone are very essential for life, and from the suprarenal gland, some hormones are secreted. They are corticotropin and mineral corticoids hormones. And when these hormones are get deficient, or when there is a tumor and that produces excessive hormone, then patient will get psychological symptoms. And then other hormones which are very important is insulin. When in the insulin deficiency, patient get diabetes. And in diabetes, we have seen nowadays 30 to 40% patient manifest like depression. And when you do blood test, we find out it is not alone depression. This is because of the undiagnosed case of diabetes. Patient was manifesting with lethargy, low mood, sleep disturbance, weakness, crying spells, and so on. And these patients, when treated for the diabetes, and then these symptoms gradually get cured. So we need to know that 30 to 40% patients with diabetes can have comorbid or manifesting as psychiatric symptoms. So these are the hormonal thing. Fourth is the autoimmune conditions. Fourth is the autoimmune conditions like autoimmune encephalitis or SLE, systemic lupus erythematosus. They are very top end things, but just listen to those things. When you read, you will feel these words are there. And these autoimmune diseases like connective tissue disorder, you can write connective tissue disorder or systemic lupus erythematosus, dermatomyositis, and other disorder like autoimmune encephalitis. These are the conditions where patient might develop certain psychological mood symptoms, sleep disturbance, cognitive error, and so on. And when they are identified by a specific blood test and by a specialist or autoimmune specialist, then they should be treated properly. Once they are treated properly, then they get benefit out of that. So these are the fourth conditions which can manifest like a psychological thing. Whenever somebody undergo because of the addiction, substance addiction like alcohol, cocaine, amphetamine, then cannabis, and other addiction like caffeine, nicotine, then these addictions can also present as psychiatric symptoms. Suppose there are CNS stimulants and CNS. CNS means central nervous system. CNS स्टिमुलेंट ब्रेन को जो स्टिमुलेट करता है एंड ब्रेन को जो इनहिबिट करता है. ब्रेन को स्टिमुलेट कौन कौन सा एडिक्टिव सब्सटेंस करते हैं, स्टिमुलेट करते हैं कैफीन, निकोटीन, देन एम्फेटामिन, कोकेन. दीज आर द सीएनएस स्टिमुलेंट. एंड सीएनएस डिप्रेसेंट कौन सा है, सीएनएस डिप्रेसेंट से कैनबिस एंड अल्कोहल, and to some extent brown sugar, opioid, that is called opioid. So whenever somebody is taking CNS stimulant, accordingly he or she gets the effect of that. Sorry. So CNS stimulants, patient will get disinhibited by taking cocaine, excessive amount of caffeine, excessive amount of um nicotine. These are the CNS stimulant. It stimulates the brain in different points: emotional center, memory centers, activity centers, and person become disinhibited. Patient become hyper excitable. Patient feels that he has lot of energy. Patient feels that patient need not require more sleep. He or she is very active and good energy to do lot of things. They will almost present like a manic patient or manic person. And these patients will, if we take history, that patient says or relative says he has been taking cocaine or amphetamine or caffeine in excess amount, nicotine added with nicotine, then we can think because of these substances, because of these psychoactive substances, patient is landing in a manic syndrome, or that is otherwise known as secondary mania. It's not a primary. Primary problem is the substance or the addictive substance, which are CNS stimulant, and because of that, patient is having problem of like a manifesting like a mania. On contrary, when somebody takes long term alcohol or cannabis or brown sugar opioid, then patient will develop long term side effects in form of uh, suicidal ideas, not able to sleep. Initially, somebody takes alcohol or cannabis to sleep. After 3 years, 4 years into the addiction, they will not able to sleep. They will become very having a lot of craving, and they might develop a lot of guilt after a long time of taking. They develop suicidal ideas, suicidal attempt, and they might get into depression. They might get into psychosis. So these are the symptoms when there is somebody is on CNS depression. Okay. So this till this we have covered six type different things which can. One is a CNS, central nervous system pathology, because of brain tumor, Parkinson, stroke, multiple sclerosis, and epilepsy. Next, we discuss about the vitamin deficiencies, and mostly the vitamin B1, niacin, vitamin B12, vitamin D, and calcium, how they manifest with different psychological symptoms. And then thirdly, we discuss a lot of autoimmune conditions like systemic lupus erythematosus, mixed connective tissue disorder, Sjogren's syndrome, and autoimmune encephalitis or autoimmune encephalopathy, leading to or presenting as lot of vague symptoms which can be equated as psychological symptoms, but later on with specialist intervention we know that they have underlying autoimmune disease. Autoimmune means body immunity or immune system is acting against own tissue, own cells, and destroying them at different places. Okay, so that is autoimmune. And on fifth position, we discuss a lot of hormonal problem, starting from hypothyroidism, hyperthyroidism, uh, hyperparathyroidism, then Addison's disease like suprarenal hormone like epinephrine, norepinephrine can be more, or in conditions like suprarenal glucocorticoids and mineralocorticoids deficiencies can also manifest like psychotic symptoms. So these are the hormonal problems. And finally, we discussed about the addiction. In nutshell, the addiction which are CNS depressant like alcohol, cannabis, opioid, brown sugar, they cause brain stimulation to be inhibited, brain stimulation to be suppressed. And because of that suppression, patient develops lot of symptoms related to which looks like somebody is not very active or proactive. Patient is very lethargic. Patient doesn't take interest in his self care. Patients become withdrawn, and all these problems. In case of CNS stimulant like caffeine and other conditions like where there is CNS stimulation like nicotine, amphetamine, cocaine, then patients will develop features suggestive of excessive hyperactivity, decreased need for sleep, excitement, feeling of excessive energy, and feeling of severe excitement, and that will patient might feel like a manic state or over or hyperactive state. Okay, up to this, I would take a break and I would invite any questions or doubts or clarification you have.
Sir, suppose one patient has a thyroid problem and he is
Hmm.
taking medicine. Sometimes it is different kinds of thyroid patient, as you told. Some are
Hmm.
they are telling 25 medicines, and some are they taking 50. If the patient will stop 1 day or 2 days the taking medicine, so what will happen, sir?
Ideally, somebody should take regular medicine even without a break. But if somebody forgets or 1 or 2 days, nothing great will happen. It is okay, but should continue as he remembers to continue the medicine. So they will not have any major problem. But yes, time to time, every once in every 6 months, they do T3, T4, TSS, and antithyroid antibody, free, free T3, free T4 labels, and these labels are normal. Patient symptomatically is better. Then we continue with the previous dose. If the patient hormones are little this side or that side, then dose is required to be adjusted accordingly. But one point
So,
is a very important question. So one point we should understand in these patients, mostly we also give them antidepressants because that the guideline, WHO guideline is you have to treat both. You have to give thyroid as a primary thing, thyroid hormone supplementation in a hypothyroid case, as well as give low dose of antidepressant for some point in time where patient will feel good and started eating well and feeling having energy, decrease crying spells, and gradually after 1, 2, 3 months we can reduce and stop antidepressant. But thyroid hormone has to be continued depending on the consultation from a endocrinologist or a thyroid expert.
okay, sir.
Is that suffice your
Sir,
answer?
sir,
Any other?
is it compulsory to take the medicine, means the thyroid medicine, till end of life, or after certain time, after few months or few years later, the patient will stop the medicine, or it will take to end of his life?
So there are hypothyroidism also are different types. If it is because of certain problem or a enzyme defect or some autoimmune conditions, Graves' disease or some other things, where lifelong supplementation is required. Suppose I have a thyroid gland tumor. My surgeon has removed the thyroid gland. Where I will synthesize my thyroid hormone? I don't have a place. So every day it has to be supplemented from outside as thyroid tablet in a small bottle and throughout the life.
Yes.
But if it is only because of seasonal thyroiditis and there is a thyroid problem and for or any other medication side effect it has started and it was identified, medication was stopped and thyroid hormone was given, and then I have to check with 3 months, 6 months, 1 year, and then the doctor might say that now the thyroid has come back to normal, no need for external support, external thyroid supplement. So depending on the cause of hypothyroidism, they will divide them into it has its own classification, and every more broadly these two type of things are there.
Okay, thank you, sir.
Any
Thank you so much.
any other questions from the student? So that part of the book where this medical disease presenting as psychological or psychiatric symptoms, have you gone through? Have you read by yourself? Anybody?
Sir, till now me not started.
You have not started, but the material has reached you.
Yes, sir. Yes, sir. It's easy.
Sir, till now I haven't received any material.
Okay. So I would request the coordinator. You also write to them. Once you get the material, it is very simple English. It is written, and with this discussion, you can read that chapter. And I want to take permission from you or stop the class now because I have fever and not able to continue the class today. And you first go through these handouts. If you have any doubt, if you have 5 doubts, 6 doubts, you write it down, and whenever the coordinator will ask me to the next class, we'll discuss on that. But before I leave, I have to tell you the presentations of psychiatric symptoms in a medical disorder, like whatever we discussed, are not are little different from the primary psychiatric disorder. What I mean to say you is, in primary psychiatric disorder, the classical symptoms of depression, mania, psychosis, OCD, anxiety disorder, personality disorder will be there. Here, there is we say it is these patients might have certain atypical of these symptoms where this gives a doubt probably other problem, but maybe there is a underlining like a underlining medical illness. So it's almost, what is the time now?
Sir, 6-9.
6:10. 6:10. So I have to take my medicine, and I'm really sorry that not able to continue this class today. But you go through your um, and my email ID I am giving you. If you can write any questions and all, we can clarify through mail. My mail ID is jpr underscore 219 jpr underscore 219 @ yahoo.co.in. You read this part of the prescribed curriculum
Sir,
or the study
once
material.
again, repeat, please. Sir, repeat, please, your
J
mail ID.
jpr
JPR,
underscore
sir,
219
2R9.
219
Yes, sir.
yahoo.co.in. yahoo.co.in. So you please read, go back and read, and give me any doubt you have. Then I will discuss those doubts, and we'll meet in the subsequent classes. Okay.
Okay, sir. Thank you so much. Take medicine, take rest. Thank you, sir.